Hi again. Okay, we will continue with the involvement of science and technology in human reproduction. Okay, first thing in this topic, we will see what is family planning. Okay, then we will discuss on infertility. Okay, and then how to overcome infertility, and also some moral issues that involve. Okay, then also a little bit on sexual transmitted disease, some example, and also the way to avoid or the way to prevent the transmission. Okay, only of three here. Okay, so we can use pill to control, or we can use some device such as condom, diaphragm, intrauterine device, or short form we use IUD, or spermicide. Spermicide is something like gel or jelly. Okay, so later in the videos, okay, I will show you all this birth control method, how it look like and how to use it. Okay, it's just for your knowledge. Okay, and also we can have surgery. Okay, but surgery it will result in a permanent sterility. Sterility means the couple, okay, if the couple plan not to have baby, okay, anymore, okay, then they can choose the surgery method. Okay, and for male and the female, the name is different. Okay, the surgery procedures have different name. Okay, so for vasectomy, okay, is for the male, tubal ligation is for the female. Okay, or the couple can choose natural method. Okay, natural method to prevent pregnancy. Okay, so one of the method is rhythm method. Okay, rhythm method is done by the woman. Okay, the woman have to very sure of her menstrual cycle. Okay, so when there is a ovulation, they have to avoid intercourse. Okay, another method is for the male. Okay, the male has to, if natural method, they have to use the withdrawal method. Okay, so we can see the first one. Okay, these are the pictures. Okay, I will show you the videos after this. Okay, so the first thing is IUD. Okay, this is for the female. Yeah, so I compile a few from your textbook. So the first one you can see here, IUD. So IUD is one of it. Okay, we insert. So IUD can prevent implantation. Okay, implantation. So this is the third one. Okay, prevent implantation. If there is fertilization, the IUD can prevent implantation. And then beside IUD also we have certain hormone that can be released also. Okay, but main thing IUD is for prevent implantation. Okay, next one we have diaphragm. Okay, diaphragm, this is for the woman condom. Okay, the diaphragm will block the cervical here. Okay, it prevent the prevent the sperm, okay, from entering the vagina. Okay, that means this is something like it can be put it by the doctor or by the female herself. Okay, another one is spermicide. Spermicide is jelly or the gel. It can be applied here. Okay, this is the cervical area. Okay, before intercourse. Okay, or we have another one we call a female condom. Okay, the female condom. Okay, it's just like the condom, just like diaphragm. Okay, just different in shape. Okay, contraceptive pill. Okay, is another birth control method that can be taken by the female, and this is a pill that has to be taken. Okay, every day. Okay, it has contain a lot of hormones. Okay, different type of hormones, just based on the menstrual cycle, the menstruation hormone. Okay, that released during the cycle. The next one is the tubal ligation. This is through the surgery, so it can cut and tie up the fallopian tube. So this part is fallopian tube. So after they cut, so even the gamete is released, yeah, it cannot reach it cannot meet up with the sperm. Okay, now contraceptive pill, the important function is to prevent ovulation. It prevent the ovum from release. Okay, so that is for female. Okay, so these are the pictures. Yeah, this is the pills. Okay, you see the arrow here, so you follow arrow. Okay, start from the first day of menstruation and then so on, and then we assume, okay, every ladies, okay, have 28. The cycle is 28 days, so you can count here, there is 28, okay, pills, or IUD. See, IUD is something like this. It's actually very small only, okay? The size of the palm, okay? So this is the female condom that we have here. Okay, diaphragm, spermicide. Okay, spermicide is to apply, yeah. Spermicide can kill. Okay, see, the spermicide can kill the sperm. Okay, and then it can actually use together with the diaphragm. Okay, then tubal ligation. So this is done by the doctor. Okay, how about the male part? Okay, the male is vasectomy. So vasectomy, the first one is which is also cut and tie, but now the doctor will cut the duct, okay, the sperm duct, okay. So here lah, this part, cut and tie. So the name is vasectomy, yeah. Then also we have condom, okay, to be put on with cause. Okay, before we continue with infertility, we will watch a video on this birth control method, yeah, for the male and the female. So just watch it, and then we continue with infertility.
Here's what has to happen for pregnancy to occur after sexual intercourse. Sperm must swim up the vagina, through the cervical opening, upwards through the uterus, and into one of the 2 fallopian tubes. If an egg, released during that month's ovulation, is in the tube, one sperm has a chance to fertilize it. Contraceptives are designed to prevent this process, and they work in 3 basic ways. They block the sperm, disable sperm before they reach the uterus, or suppress ovulation. Block is the simplest. Male and female condoms prevent sperm from coming into contact with the vaginal space. That barrier is also why they, unlike other contraceptive methods, are able to prevent transmission of certain sexually transmitted diseases. Meanwhile, the diaphragm, cervical cap, and sponge work by being placed over the cervix, barricading the entrance to the uterus. These contraceptives are sometimes called barrier methods and can be used with spermicides, an example of the second category, disable. A spermicide is a chemical that immobilizes and destroys sperm. Today's spermicides come as foam, cream, jelly, suppositories, and even a thin piece of translucent film that dissolves in the vagina. These products can be inserted directly into the vagina before intercourse, or can be combined with block methods, like a diaphragm or condom, for added protection. The third category for preventing pregnancy works by suppressing the action of an egg maturing in the ovary. If there isn't an egg available in the fallopian tube, there's nothing for sperm to fertilize. Hormonal contraceptives, including the pill, the patch, the depot shot, and the vaginal ring, all release synthetic versions of various combinations of progesterone and estrogen. This hormone cocktail suppresses ovulation, keeping the immature egg safely sequestered in the ovary. Synthetic progesterone also has a block trick up its sleeve. It makes cervical mucus too thick and sticky for sperm to swim through easily. There are other contraceptives that use multiple approaches at the same time. For example, many IUDs, or intrauterine devices, contain synthetic hormones which suppress ovulation. Some also contain copper, which disables sperm while also making egg implantation in the uterus difficult. Block, disable, or suppress. Is one strategy better than the other? There are differences, but a lot of it has to do with how convenient and easy it is to use each contraceptive correctly. For example, male condoms would be about 98% effective if everyone used them perfectly. That 98% means if 100 couples correctly used condoms for a year, 2 women would get pregnant. But not everyone uses them correctly, so they're only 82% effective in practice. Other methods, like the patch and pill, are 99% effective when they're used perfectly. But in practice, that's 91%. Spermicide is only 85% effective, even with perfect usage, and just 71% effective with typical usage. Another important consideration in the choice of contraceptives are side effects, which almost exclusively affect women rather than men. Hormonal methods in particular can cause symptoms like headaches, nausea, and high blood pressure, but they vary from woman to woman. That's why these methods require a prescription from a doctor. The choice of contraceptive method is a personal one, and what works best for you now may change later. scientists also continue to research new methods, such as a male pill that would prevent sperm production. In the meantime, there are quite a few options to block sperm, disable them, or suppress eggs and keep them out of reach.
A tubal ligation procedure is a permanent method of birth control, where the surgeon cuts or seals off the fallopian tubes in order to prevent pregnancy. A woman's reproductive system includes the vagina, the canal where sperm are deposited and babies emerge during delivery; uterus, the pear-shaped organ where a fertilized egg grows into a baby; fallopian tubes, two ducts that transport eggs from the ovaries to the uterus and where sperm usually fertilize eggs; and ovaries, two glands that produce and release eggs. During sexual intercourse, sperm from the male are introduced into the vagina. They travel through a channel called the cervix and into the uterus. The sperm then move into the fallopian tubes, where they can meet and fertilize eggs that have been released from the ovaries. Pregnancy begins with a fertilized egg. If you don't want to become pregnant, you may choose a birth control method from one of several categories: abstinence, contraception, or sterilization to permanently avoid pregnancy by having a medical procedure. Tubal ligation is one form of sterilization. Before the procedure begins, an intravenous line will be started, and you will be offered medication to help you relax. Local anesthesia will be applied to numb the area of the operation, and you will remain awake for its duration. In some cases, general or spinal anesthesia may be used instead. If you are having a laparoscopic tubal ligation, your doctor will begin by making a tiny incision near your belly button and another just above your pubic bone. Your doctor will then inject carbon dioxide, a harmless gas, through a tube inserted into the upper incision. The carbon dioxide inflates your abdominal cavity, allowing your doctor to clearly see and work around your internal organs. Next, your doctor will introduce a lighted instrument called a laparoscope through one of the incisions. The laparoscope projects images of the structures inside your abdomen onto a monitor. Through the other incision, your doctor will pass surgical instruments to grasp your fallopian tubes and close them off using the cutting and tying, blocking, or sealing technique. At the end of the procedure, your doctor will allow the carbon dioxide to escape and close the incisions with dissolving stitches. If you are having a mini laparotomy tubal ligation, your doctor will make a small incision just above your pubic bone. He or she will grasp the fallopian tubes with forceps and close them off using one of several techniques. At the end of the procedure, the incision will be closed with stitches. This method is often used just after childbirth. If you're having a laparotomy, your doctor will make a 2 to 5 inch incision in your lower abdomen. He or she will locate the fallopian tubes and close them off using one of several techniques. At the end of the procedure, the incision will be closed with stitches. Immediately afterward, you will be taken to the recovery area. If you have a laparoscopic tubal ligation, you will likely go home the same day. If you have a laparotomy or a mini laparotomy after childbirth, your hospital stay may be extended slightly.
A series of events called the menstrual cycle happens about once every month to prepare a woman's body for pregnancy. Changing levels of natural chemicals in the bloodstream, called hormones, control these events. The reproductive organs affected by these hormones include the vagina, cervix, uterus, fallopian tubes, and ovaries. The ovaries produce two main hormones called estrogen and progesterone. As the level of estrogen begins to rise, it causes the normally thick mucus inside the cervix to thin out. Estrogen also triggers other hormones to cause one of the ovaries to release an egg. This process is called ovulation. If a woman has sex during this time, a man's reproductive cells, called sperm, can pass through the thinner mucus to fertilize an egg. In the uterus, estrogen causes the lining to thicken, which prepares it to receive a fertilized egg. Rising progesterone levels cause glands in the lining to release fluid that feeds the fertilized egg. Progesterone also causes the thinned-out mucus in the cervix to become thick again, which prevents sperm from passing through. If an egg hasn't been fertilized, the levels of both estrogen and progesterone begin to fall. This drop in hormone levels causes menstruation, a process where the uterus sheds its inner tissue lining and blood through the vagina. An intrauterine device, or IUD, is a birth control method consisting of a soft, flexible T-shaped device with a thin string on the end. There are two types of intrauterine devices: hormonal IUDs and a copper IUD. To prevent pregnancy, a doctor places an IUD inside a woman's uterus with the string hanging down inside her vagina. Both types of IUD cause mild inflammation of the uterine lining, which releases immune cells and chemicals that kill sperm. Hormonal IUDs also contain a synthetic type of progesterone called levonorgestrel. Levonorgestrel mainly prevents pregnancy by thickening the mucus inside the cervix, which prevents sperm from entering the uterus. It also prevents the uterine lining from thickening, so it is less likely to receive a fertilized egg. About a month after inserting an IUD, the doctor may schedule an exam to make sure it is still in place. The doctor may also teach the woman how to check her IUD between visits by feeling for the string inside the vagina. Depending on the type, an IUD can be left in place for 3 to 10 years. Women can have their doctor remove an IUD at any time for any reason, including the desire to have children. An intrauterine device, or IUD, is one of the most effective methods of birth control. IUDs are over 99% effective at preventing pregnancy. This means that less than 1 out of 100 women will become pregnant each year if they use an IUD and check it regularly for correct placement. However, IUDs are only about 97% effective if not checked for correct placement. For more information on any type of birth control, talk to your doctor.
Infertility. Okay, infertility can caused by a few factors. First thing, maybe the health problem. Okay, maybe the habit. Okay, the living style. Okay, when you take drug or have alcohol, it actually reduce the the gamete, the production of gamete. Okay, let us see some of the causes for infertility in these short videos, okay?
Hello. Today we talk about infertility by following the story of Scarlett and Mark. Scarlett and Mark, both in their mid-30s, have been married for 5 years, but due to their busy work schedules, they're gradually growing apart. After around 2 years of trying to conceive a child, they started thinking that maybe one of them is infertile. Now, what is infertility? The general consensus for a definition is that it is the inability to conceive after a year of sexual intercourse. Scarlett and Mark have been trying to conceive for a reasonable period of 2 years, which is over the length of time needed to meet the requirement of infertility. When suspecting of infertility, the first recommended step is to see a doctor. It is common to wonder why you or your partner may be infertile. Infertility is caused by a wide variety of factors and can stem from both the male and female body. 50% of all cases of infertility are affected by male factor infertility, and 30% of them are solely affected by male factor infertility. Low sperm count, abnormal sperm shape, as well as abnormal sperm motility are all part of male factor infertility. One of the most common causes of male factor infertility are hormonal irregularities and genetics, as they can both account for why a male may be producing dysfunctional sperm. Exposure to toxins like chemotherapy, radiation, anabolic steroids, tobacco, alcohol, and other drugs can also affect sperm production. Additionally, neurological issues, infectious disease, and disorders that affect the lungs, kidneys, or liver can also lead to impairments in sperm production or delivery of sperm to the female genital tract. For females, age is the most commonly associated cause of infertility. This association is a result of the increase in the average age of having a child. As women age, their fertility declines. A woman's fertility starts to decline in her early 30s, with the decline speeding up after the age of 35. This is mostly due to the ovaries becoming less efficient. Another factor for female infertility is endometriosis. It is a disease that is characterized by the development of endometrial tissue outside of the uterus, causing pain and infertility. Specifically, endometriosis has a 50% prevalence rate in infertile women. This disease causes inflammation, making the uterus an inhospitable environment, and can damage the embryo. In severe cases, endometriosis can block the fallopian tubes and block sperm migration. Endometriosis reduces reproductive potential by approximately 10%, but it is noted that endometriosis lowers fertility but does not prevent conception. Female infertility also includes problems with cervix, damage to the fallopian tubes or uterus, as well as problems with ovulation, which is the process through which female eggs are released by ovaries. Overcoming infertility can be a challenging task, but there are some lifestyle changes that can help you increase the chances of getting pregnant. For example, eating a healthy diet, not smoking, exercising regularly, drinking alcohol in moderation, reducing stress, as well as consulting a doctor are all things that can help. Additionally, there are some medical treatments that can help if infertility continues. Some couples want to explore more traditional or over-the-counter efforts before exploring infertility procedures. There are numerous fertility drugs available to help make males and females more viable, reproductively speaking. For example, Brovel is a common female fertility drug. It provides the hormones that help cause the ovaries to produce eggs. This medication helps with the growth and release of a mature egg during ovulation. Most fertility drugs for men are gonadotropins, which stimulate the testes to produce testosterone and sperm. It is best to consult healthcare personnel about which fertility drug to use based on your age, sex, and medical history, among other factors. The common medical procedure to correct for male factor infertility is intrauterine insemination, abbreviated to IUI. An IUI involves placing sperm inside a woman's uterus to make fertilization easier. The goal is to increase the number of sperm that reach the fallopian tubes and therefore increase the chance of fertilization. The IUI treatment gives the sperm an advantage by giving it a head start, but still requires a sperm to reach and fertilize the egg on its own. The cost for this procedure is approximately $1,000. In vitro fertilization is a procedure in which mature eggs are collected from the ovaries and fertilized by sperm in a lab. Then the fertilized egg or embryo is implanted in the uterus. The IVF treatment is often stated as being the most effective form of assisted reproductive technology. IVF treatment can be performed using the mother's eggs and the partner's sperm, or the IVF may involve eggs, sperm, or even embryos from known or anonymous donors. The cost of an IVF treatment can be from $20,000 to $25,000 per female reproductive cycle. This treatment may be used in severe cases such as when there are damaged fallopian tubes, low sperm count, ovulation disorders, and unexplained infertility, among other reasons. If you've been diagnosed with infertility or fear you may have trouble conceiving in the future, you're not alone. The medical industry is forever making advances in this field. Make an appointment with your doctor and go over your concerns. Even if you are diagnosed with infertility, you may still be able to conceive.
The good news is there's a lot both men and women can do to stay healthy to increase their chances of becoming pregnant. Couples who are trying to conceive should eat a healthy, well-balanced diet, get regular exercise, and avoid tobacco, alcohol, and recreational drug use. Infertility problems can be frustrating and stressful, and emotional health can also impact your ability to conceive. If you need help dealing with stress, talk to your doctor about Kaiser Permanente's stress management classes and other support services. For heterosexual couples, having frequent intercourse, especially around the time of ovulation when a woman is most fertile, will also improve a couple's chances of becoming pregnant. For women, treatments include medications, insemination, and in vitro fertilization. Your doctor may recommend one or more of these treatments to help you get pregnant.
I'd like to show you the medications, the different kind of medications that we might use.
Medications are often used as part of infertility treatment to encourage the woman's body to release more eggs. Your clinician may suggest two types, an oral medication or one that's injected. If you're prescribed a medication, you may also need to have periodic ultrasounds and blood tests to monitor your response to the treatment. If you're prescribed injections, most patients find them easy to do and will teach you how to do them before you go home.
And just go straight in, nice and easy.
Sometimes, giving the sperm a shortcut by placing them directly into the uterus raises the odds of a woman becoming pregnant. This is called intrauterine insemination. Insemination can be done using a partner's sperm or donor sperm from a sperm bank.
When will I know how many eggs I'll get?
So after I get done with the procedure, I'll come and talk to you when you're a little bit awake and tell you how many eggs you have.
Okay, great.
Through in vitro fertilization, also called IVF, eggs can be fertilized outside a woman's body and the embryos are placed back into her uterus to develop. IVF often works for women who have fallopian tube problems, when sperm issues can't be solved, or when other methods have been unsuccessful. For single women and same-sex couples who want to conceive, Kaiser Permanente offers infertility evaluations and possible treatments, including insemination and in vitro fertilization.
And then how to overcome infertility, okay? That means we have a few methods lah. So the first one we see is artificial insemination. Artificial insemination, if you read up, this is actually we have the sperm from the father and then insert into the woman straight to the fallopian tube of the vagina. Okay, that means this is for if the man have a low sperm count. Okay, if the man have the low sperm count, doctor will suggest the man to use or the couple to have this method. Okay, artificial insemination. Let's say if the couple do not produce a healthy sperm, okay, then they can refer to sperm bank. Or even there is a mother, okay, they do not wish to get a partner, alright, but still they want to have a baby, they can also go or get the sperm from the sperm bank. Okay, another one which is very famous is in vitro fertilization. Okay, so in vitro fertilization, or we call the test tube babies, is when is when the doctor get the ovum and the sperm from the couple, and then it just how to say, they fertilize it outside the body, and then after they success to fertilize into a zygote, and then they will have to put it back to the mother, and then the mother can continue with the pregnancy. Okay, so that means the baby will develop inside the mother, but the fertilization is done outside of the body. Okay, now surrogate mother is when the woman doesn't have, or the uterus is not suitable, okay, for the mother to carry baby, so they will find a woman. Okay, most of the time there is a relationship, maybe the sister, the mother, grandmother. Okay, so they will help to carry the zygote, and then until it becomes fetus, and then they give birth, and this baby is belong to the couple lah. Okay, ovum and sperm from the couple, but instead of like in vitro fertilization, instead of putting in the mother, okay, it is put inside a surrogate mother. Okay, so there are news on the, sometime when we go and search, really news on this surrogate mother, the successful example. Okay, now this is how we do the IVF. So first thing, we get the matured ovum, then after that we fertilize. Okay, of course it's not that easy. I have to done under a very controlled method of fertilize, a sterile method. Okay, very clean environment. Okay, now then after it fertilize, it has to transfer back into the mother uterus. You see? Okay, so the baby is still developed in the mother. Okay, so this is how we do, and this is how they do the in vitro fertilization. Okay, so the moral issue related to contraception is the religious and the belief. So sometimes when we say contraceptive, because we prevent pregnancy, so that means we will take this contraceptive as a killing, because even though it's still not formed yet, okay, but still we prevent it from forming, okay, we actually killing the embryo or zygote. Okay, but most of the religious, they accept natural contraception, okay, because there is not yet formed. Okay, there is no embryo or zygote is formed. So you can read more on that. Okay, now how about sexual transmitted disease? So this disease, from the word sexual transmitted disease, is mean that the disease that is transmitted sexually, okay, through sexual intercourse. Okay, how is it being transmitted? Okay, it's due to the bacteria or viruses. Okay, so the example that is the disease that is transmitted by bacteria is the chlamydia. Okay, so this chlamydia bacteria will cause the inflammation of the cervix area, and then, or the bacteria gonorrhea, it will cause the inflammation at the genital mucous membrane. So these are the symptoms. Okay, and these are the pictures that shows. Okay, you just read up lah. Okay, and then let's say there's another one, okay, caused by bacteria. Okay, the third one, which is syphilis. Okay, the third one is caused by bacteria, is syphilis. Okay, also you can just read out, and this not only affect the genital part, it also affect the body organs. Okay, blister. Okay, something like this. Okay, blister. Okay, then yes, we have genital wart, also caused by virus, and AIDS. Okay, caused by virus. So what is STD? Yeah, this one should come before. Okay, never mind, just put inside your notes. So STD is sexual transmitted disease. Okay, and it is spread, okay, mostly by sexual intercourse. Okay, but not only sexual intercourse. Okay, just now I mentioned, right, hepatitis B can cause or it can spread, okay, by body fluid, any of the body fluid. So example given here, HIV, blah blah blah. Here, this one is already mentioned. So what caused the STD? Okay, the germs. Okay, it can be grouped under bacteria or viruses, and this germ can hide, or it can be found in the semen, the blood, sometimes the saliva. For example, hepatitis B, it's believed, okay, it's believed it can be transmitted through the saliva. Okay, most of the organisms are spread by vagina, anal, or oral sex, but some, okay, can be passed down or spread, okay, through the skin contact. So how to avoid? Okay, how to avoid? So since it's from the sexual intercourse, so of course we prevent from having sexual intercourse. But let's say it's a couples, okay, so we must have a protected sex, or when we have intercourse, it must be safe, okay, using condom. Or if you have a new partner, okay, make sure you or your partner is tested negative for STD for at least 6 months. How we avoid with this sexual transmitted disease, yeah. Okay, last one is, these are the videos that I took from. Okay, so we will stop. Alright, before we end the videos, we will watch the videos on the techniques to overcome infertility, which include the IVF fertilization.
In 1978, Louise Brown became the world's first baby to be born by in vitro fertilization, or IVF. Her birth revolutionized the field of reproductive medicine. Given that approximately 1 in 8 heterosexual couples has difficulty conceiving, and that homosexual couples and single parents often need clinical help to make a baby, the demand for IVF has been growing. IVF is so common that more than 5 million babies have been born through this technology. IVF works by mimicking the brilliant design of sexual reproduction. In order to understand IVF, we first need to take a look at the natural process of baby making. Believe it or not, it all starts in the brain. Roughly 15 days before fertilization can happen, the anterior pituitary gland secretes follicle-stimulating hormone, FSH, which ripens a handful of follicles of the ovary that then release estrogen. Each follicle contains 1 egg, and on average, only 1 follicle becomes fully mature. As it grows and continues to release estrogen, this hormone not only helps coordinate growth and preparation of the uterus, it also communicates to the brain how well the follicle is developing. When the estrogen level is high enough, the anterior pituitary releases a surge of luteinizing hormone, LH, which triggers ovulation and causes the follicle to rupture and release the egg. Once the egg leaves the ovary, it is directed into the fallopian tube by the finger-like fimbriae. If the egg is not fertilized by sperm within 24 hours, the unfertilized egg will die, and the entire system will reset itself, preparing to create a new egg and uterine lining the following month. The egg is the largest cell in the body and is protected by a thick extracellular shell of sugar and protein called the zona pellucida. The zona thwarts the entry and fusion of more than 1 sperm, the smallest cell in the body. It takes a man 2 to 3 months to make sperm, and the process constantly renews. Each ejaculation during sexual intercourse releases more than 100 million sperm, but only 100 or so will ultimately make it to the proximity of the egg, and only 1 will successfully penetrate through the armor of the zona pellucida. Upon successful fertilization, the zygote immediately begins developing into an embryo and takes about 3 days to reach the uterus. There, it requires another 3 or so days to implant firmly into the endometrium, the inner lining of the uterus. Once implanted, the cells that are to become the placenta secrete a hormone that signals to the ovulated follicle that there is a pregnancy in the uterus. This helps rescue that follicle, now called the corpus luteum, from degenerating as it normally would do in that stage of the menstrual cycle. The corpus luteum is responsible for producing the progesterone required to maintain the pregnancy until 6 to 7 weeks of gestation, when the placenta develops and takes over until the baby is born approximately 40 weeks later. Now, how do you make a baby in a lab? In patients undergoing IVF, FSH is administered at levels that are higher than naturally occurring to cause a controlled overstimulation of the ovaries, so that they ultimately produce multiple eggs. The eggs are then retrieved just before ovulation would occur, while the woman is under anesthesia through an aspirating needle that is guided by ultrasound. Most sperm samples are produced by masturbation. In the laboratory, the identified eggs are stripped of surrounding cells and prepared for fertilization in a petri dish. Fertilization can occur by one of two techniques. In the first, the eggs are incubated with thousands of sperm, and fertilization occurs naturally over a few hours. The second technique maximizes certainty of fertilization by using a needle to place a single sperm inside the egg. This is particularly useful when there is a problem with the quality of the sperm. After fertilization, embryos can be further screened for genetic suitability, frozen for later attempted pregnancies, or delivered into the woman's uterus via catheter. Common convention is to transfer the embryo 3 days after fertilization, when the embryo has 8 cells, or on day 5, when the embryo is called a blastocyst and has hundreds of cells. If the woman's eggs are of poor quality due to age or toxic exposures or have been removed due to cancer, donor eggs may be used. In the case that the intended mother has a problematic uterus or lacks one, another woman, called a gestational carrier or surrogate, can use her uterus to carry the pregnancy. To increase the odds of success, which are as high as 40% for a woman younger than 35, doctors sometimes transfer multiple embryos at once, which is why IVF results in twins and triplets more often than natural pregnancies. However, most clinics seek to minimize the chances of multiple pregnancies, as they are riskier for mothers and babies. Millions of babies, like Louise Brown, have been born from IVF and have had normal, healthy lives. The long-term health consequences of ovarian stimulation with IVF medicines are less clear, though so far, IVF seems safe for women. Because of better genetic testing, delayed childbearing, increased accessibility, and diminishing costs, it's not inconceivable that artificial baby making via IVF and related techniques could outpace natural reproduction in years to come.
In vitro fertilization is a process where a woman's eggs are fertilized outside her body, then placed back inside her body to help her get pregnant. A woman's reproductive system includes the vagina, cervix, uterus, fallopian tubes, and ovaries. During the monthly menstrual cycle, one of the ovaries releases an egg in a process called ovulation. After ovulation, the egg enters the fallopian tube. A woman is most likely to become pregnant if she has sex in the days just before, during, or right after ovulation. During this time, a sperm cell from a man's reproductive fluid, called semen, is able to fertilize the egg just inside the fallopian tube. As it travels along the fallopian tube, the fertilized egg, now called an embryo, loses the outer cells that nourished it in the ovary. The embryo passes from the fallopian tube into the uterus. In the uterus, the embryo sheds its protective outer layer, called the zona pellucida, in a process called zona hatching. Zona hatching is necessary for the embryo to implant in the tissue lining the uterus. During implantation, a connection between the woman and the embryo begins to grow. This organ, called the placenta, allows oxygen and nutrients to pass from her to the embryo. In vitro fertilization may be performed if a woman has been having trouble getting pregnant, a condition known as infertility. Or it may be done if a woman wants to have a child without a male partner. Before in vitro fertilization, a woman will receive fertility medication that causes more than one egg to grow and mature in the ovaries. A man will provide a semen sample so that the healthiest sperm can be collected for fertilization. If the male partner is completely infertile, also known as sterile, or the woman doesn't have a male partner, a donor may be arranged to provide sperm for this process. In vitro fertilization consists of 3 main procedures: follicle aspiration, fertilization, and embryo transfer. During the first procedure, called follicle aspiration, eggs will be harvested from the ovaries. At the beginning of this procedure, an ultrasound probe will be inserted into the woman's vagina so that her doctor can view her ovaries. Inside the ovaries, the doctor will look for follicles. Each follicle is a fluid-filled sac that contains an egg. Then the doctor will insert a long, thin needle into and through the wall of her vagina and guide it to the ovary. A suction device connected to the needle will collect several eggs from inside their follicles. During the second part of in vitro fertilization, called fertilization, the collected eggs will be taken immediately to a laboratory where they will be fertilized. Fertilization may be performed by insemination, where several sperm are mixed with the healthiest eggs. Or the eggs may be fertilized with sperm injected directly into them during a process called intracytoplasmic sperm injection. The fertilized eggs, also called embryos, will be monitored for 3 to 5 days as they begin to grow. At this time, the lab may create a hole in the zona pellucida surrounding some of the embryos. This process, called assisted hatching, will help these embryos implant in the uterus. Some of the embryos will be used right away for embryo transfer, and the rest will be frozen and stored for future use if necessary. The third part of in vitro fertilization is called embryo transfer, which is done 3 to 5 days after fertilization. During embryo transfer, a tool called a speculum will be inserted into the woman's vagina so that the doctor can see her cervix. A syringe will be loaded with fluid containing 1 or more of the hatched embryos. Then the syringe will be attached to a long, thin tube called a catheter. The doctor will insert the catheter into the vagina, through the cervix, and into the uterus. Once inside the uterus, the doctor will inject the embryos. Then the catheter and speculum will be removed. The woman may continue to lie on her back for about 15 minutes.
There are many would-be parents today who are unable to conceive and/or carry a child naturally. Unlike many years ago, however, today there are some very viable options available to help these would-be parents have the child that they so much want and deserve. The process of surrogacy entails the use of one woman's uterus to implant and carry the embryo of a child, as well as to deliver the baby for another individual or couple. The woman who carries the child is referred to as a surrogate mother. Here's how the surrogacy process works. Most intended people start their journey by filling out the surrogate mother application. This application asks about your lifestyle, pregnancy, medical and work history, which acts as a basis to match you with appropriate intended parents. Once your application is accepted, you will receive a call from a surrogacy coordinator who will gather more information about you and your family. You will then be briefed about the programs and options available, the detailed process of matching with a surrogate, the legal process, insurance issues, financial implications, and basic medical information. Once everything is in order and the selection of surrogate is done, introductions between the intended parents and the surrogate are facilitated. When the joy of pregnancy is achieved, you and your surrogate are prepared to welcome your child home.